Digestive diseases are a common health issue affecting millions of people around the world. From acid reflux to inflammatory bowel disease, there are a variety of conditions that can affect the digestive system, each with its own set of symptoms and causes. In this video, we will explore 10 of the most common types of digestive diseases, including their symptoms, causes, and treatment options. Whether you are someone who suffers from a digestive disorder or you simply want to learn more about these conditions, this video will provide you with helpful information that you can use to better understand and manage digestive health. So, sit back, relax, and let's dive into the world of digestive diseases. 1. Acid reflux. Also known as gastroesophageal reflux disease, GERD, occurs when the lower esophageal sphincter, a ring of muscle that acts as a valve between the esophagus and stomach, fails to close properly, allowing stomach acid and digestive juices to flow back up into the esophagus. This can cause a range of uncomfortable symptoms such as heartburn, a burning sensation in the chest, and regurgitation of food or sour liquid. While occasional acid reflux is common and usually harmless, frequent or severe cases can lead to complications such as inflammation of the esophagus or development of esophageal cancer. Obesity, smoking, alcohol consumption, and certain medications such as aspirin or ibuprofen are some of the risk factors that can contribute to the development of acid reflux. 2. Gastritis. Gastritis is a digestive disorder characterized by inflammation of the stomach lining. The symptoms of gastritis can include abdominal pain, bloating, nausea, vomiting, loss of appetite, and indigestion. The condition can be acute, meaning it develops suddenly and resolves quickly, or chronic, meaning it develops over time and persists for weeks, months, or even years. Bacterial infections, such as Helicobacter pylori, prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, excessive alcohol consumption, and stress are some of the common causes of gastritis. Treatment options for gastritis may include lifestyle modifications, medications to reduce inflammation and acid production, and antibiotics to treat bacterial infections. 3. Inflammatory bowel disease, IBD. Inflammatory bowel disease, IBD, refers to a group of disorders that cause chronic inflammation in the digestive tract. The two main types of IBD are Crohn's disease and ulcerative colitis, which can affect different parts of the digestive system and have distinct symptoms. Common symptoms of IBD include diarrhea, abdominal pain and cramping, rectal bleeding, weight loss, fatigue, and fever. IBD is a chronic condition, which means that it requires ongoing management and treatment to help control symptoms and prevent complications. Treatment options for IBD may include medications to reduce inflammation and suppress the immune system, dietary modifications, and surgery in severe cases. 4. Irritable bowel syndrome, IBS. Irritable bowel syndrome, IBS, is a common functional gastrointestinal disorder that affects the large intestine. Unlike IBD, IBS does not cause inflammation or damage to the digestive tract, but it can still cause significant discomfort and disruption to daily life. Common symptoms of IBS include abdominal pain and cramping, bloating, gas, constipation, and diarrhea. The symptoms can vary in severity and frequency from person to person, and they can be triggered by a range of factors, including stress, certain foods, hormonal changes, and medications. While there is no cure for IBS, treatment options may include dietary changes, stress management techniques, and medications to relieve symptoms. 5. Peptic ulcers. Peptic ulcers are a type of sore that can develop in the lining of the stomach, esophagus, or duodenum, the first part of the small intestine. These ulcers can cause symptoms such as abdominal pain, bloating, nausea, vomiting, and loss of appetite. The most common causes of peptic ulcers are infection with Helicobacter pylori, H. pylori, bacteria, prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, and excessive alcohol consumption. H. pylori is a common bacterial infection that can cause inflammation and damage to the lining of the stomach or small intestine, leading to the development of ulcers. NSAIDs, such as aspirin or ibuprofen, can irritate the lining of the digestive tract and increase the risk of peptic ulcers. Treatment options for peptic ulcers may include antibiotics to treat H. pylori infection, medications to reduce stomach acid production, and lifestyle modifications to reduce risk factors such as alcohol consumption and use of NSAIDs. 6. Diverticulitis. Diverticulitis is a condition where small pouches or sacs called diverticula form in the lining of the colon and become inflamed or infected. The symptoms of diverticulitis can include abdominal pain and tenderness, bloating, constipation, diarrhea, fever, and nausea. The condition is caused by a combination of factors, including a low-fiber diet, lack of exercise, obesity, and genetic predisposition. A low-fiber diet can cause the colon to strain during bowel movements, leading to the formation of diverticula. If bacteria become trapped in these diverticula, they can become inflamed or infected, causing diverticulitis. Treatment options for diverticulitis may include antibiotics to treat the infection, pain medications, dietary changes to increase fiber intake, and, in severe cases, surgery to remove the affected portion of the colon. 7. Celiac disease. Celiac disease is an autoimmune disorder in which the immune system attacks the small intestine when gluten, a protein found in wheat, rye, and barley, is consumed. The resulting inflammation and damage to the small intestine can cause a range of symptoms, including abdominal pain, bloating, diarrhea, constipation, fatigue, and weight loss. The only treatment for celiac disease is to follow a strict gluten-free diet for life. This involves avoiding all foods that contain wheat, rye, and barley, as well as other gluten-containing grains such as spelt, kamut, and triticale. Individuals with celiac disease must also be careful to avoid cross-contamination with gluten in foods that are processed in facilities that also handle gluten-containing products. With a proper gluten-free diet, most people with celiac disease can manage their symptoms effectively and prevent long-term complications such as malnutrition, osteoporosis, and other autoimmune disorders. 8. Lactose intolerance. Lactose intolerance is a common digestive disorder that occurs when the body is unable to break down lactose, a sugar found in milk and other dairy products. This happens when the body doesn't produce enough lactase, the enzyme needed to digest lactose. As a result, lactose can't be absorbed into the bloodstream and remains in the digestive system, causing a range of symptoms including abdominal pain, bloating, gas, and diarrhea. While lactose intolerance can't be cured, it can be managed by avoiding lactose-containing foods or by taking lactase enzyme supplements before consuming dairy products. Many people with lactose intolerance are able to tolerate small amounts of lactose, so it's important to work with a healthcare provider or registered dietitian to determine the right level of lactose consumption for individual needs. Additionally, many lactose-free dairy products are available in stores, and there are many non-dairy sources of calcium and other important nutrients that can be incorporated into a lactose-free diet. 9. Gastroesophageal reflux disease, GERD. Gastroesophageal reflux disease, GERD, is a chronic and more severe form of acid reflux where stomach acid regularly flows back up into the esophagus, causing persistent symptoms such as heartburn, chest pain, regurgitation, and difficulty swallowing. GERD occurs when the lower esophageal sphincter, LES, a ring of muscle that acts as a barrier between the stomach and the esophagus, becomes weakened or relaxes abnormally, allowing stomach acid to flow back into the esophagus. Other factors that can contribute to GERD include obesity, smoking, pregnancy, hiatal hernias, and certain medications such as those for asthma or high blood pressure. Treatment options for GERD include lifestyle changes such as weight loss, quitting smoking, avoiding trigger foods, and elevating the head of the bed. Medications such as antacids, proton pump inhibitors, and H2 blockers can also be used to manage symptoms, and in severe cases, surgery may be recommended to strengthen the LES. It's important to work with a healthcare provider to properly diagnose and manage GERD to prevent long-term complications such as esophagitis, Barrett's esophagus, and esophageal cancer. 10. Gallstones. Gallstones are small, hard deposits that can form in the gallbladder, a small organ located beneath the liver that stores bile. Bile is a fluid that helps to digest fats. Gallstones can range in size from a grain of sand to a golf ball and can cause a range of symptoms such as abdominal pain, bloating, nausea, and vomiting. They can be caused by a buildup of cholesterol or bilirubin in the bile, which can result from a variety of factors such as obesity, rapid weight loss, pregnancy, and certain medications. Treatment for gallstones may include medications to dissolve the stones, but in many cases, surgery to remove the gallbladder may be necessary. This procedure, known as a cholecystectomy, is typically performed laparoscopically, and patients can usually return to normal activities within a few days. It's important to talk to a healthcare provider if you experience symptoms of gallstones to determine the best course of treatment for your individual needs. In conclusion, understanding the common types of digestive diseases can help you identify the symptoms and seek appropriate treatment. While some digestive disorders may require medical intervention, others can be managed through lifestyle changes such as a healthy diet and regular exercise. It's important to talk to your healthcare provider if you experience any symptoms related to digestive health. We hope this video has provided you with valuable information about digestive diseases, and we encourage you to share it with others who may benefit from this knowledge. Thank you for watching, and we wish you good digestive health.